Dr. Payne Show, 1-855-55 Dr. Lou, DRLOU. You can also call here today and talk to us over the next hour, 416-870-6400, star 640 on cell. You just got back from being south. How was that for the old bones and joints, buddy?
Yeah, it felt good. It doesn't feel good now that I'm back, but it was nice while I was down there, that's for sure. How's things with you guys?
Good, man. Good.
Yeah, awesome.
Good. What do you got going on today?
Well, some interesting stuff. Actually, I thought this would be an interesting story to share. It's not exactly positive, but it kind of highlights the reality of what I try to do for people. So I had a person that gave me a call. She was recommended to call me from someone else. I don't know if she's a listener of the show. I just remember her saying that someone else told her to call me. I'm not going to go through in detail what her issue was because I don't think it really matters towards the story. So she goes on about her issue, and as I'm going, I'm asking her, like, have you done this? Have you done that? So after I'm done speaking to her for about 10 minutes, I tell her, I say, well, she wants to come see me. And I tell her, I don't think that that's actually the best course of action right now. I think dealing with your family doctor is actually the better course of action right now. Continue dealing with him or her and maybe get a referral to this type of specialty is what I suggested. But otherwise, I don't think it's something that I'm going to add value to for your care. And she, quote unquote, told me that she was severely disappointed with my service. And I was kind of like, well, and I just thought it was interesting because I thought this is how I am when I'm speaking to people. If I don't think that I can help you or my team can help you, I'm not going to make that recommendation. Like I'm not in this to try to fool people into coming to see me or whatever.
Better that way.
Yeah, and I just wanted to be honest with her. I was like, I'm really sorry that you're disappointed, but you could come see me, you could pay the fee to see me, and I'm not going to be able to tell you much more than I'm telling you right now. And you're going to have to drive. She lived about an hour and a half away. And I was like, so I'm really trying to do this for you more than I am for me. And in all honesty is that, the reality is that you're not going to benefit from seeing me. You have an issue that I think needs to be dealt with your family doctor and continue doing so. And so, I just think it really, I wanted to bring it up because I really want to stress the way I go about the phone consultation. Not everybody that calls me turns into a patient of mine because some people, like this lady, I'm not going to be able to help them. I'm not set up, not necessarily that I'm not set up, but it's not necessarily what we are experts in at what we do.
Sure.
And so if we're not experts in it, we're not going to deal with it. And so it was kind of interesting. I think a lot of people, the vast majority of people that I've dealt with, that I've given them that advice, they are extremely happy. I had another gentleman that I was making my calls, and I actually had called him maybe 4 or 5 calls before I called this lady. And he was up in Barrie, and he had been having a long-standing low back issue, which obviously I'm well-equipped to deal with.
Yep.
He was considering the option of potentially having surgery, and kind of wanted to get to see a neurosurgeon. Basically said that it's taken a long time for him to get to a neurosurgeon at this point. Is there anything else that he can do at this point? Can he come see me? And I went through everything with him, and I kind of said, like, listen, there's a wait list for neurosurgery no matter what. And so when there's a wait list, it's for a reason. Number one, I think the stat is, I can't remember, but I remember there was a research study that came out a few years ago that something like 96 or 97% of people that see a spine surgeon don't actually need to see that spine surgeon, which essentially means that out of every 100 people that a spine surgeon has seen, he or she is only really operating on 1 or 2 or 3 people, which means that there's 97 people that are sent there that have some type of low back pain issue that's not being dealt with the right way. And so that's number one, the reason for the long wait list there. Number two, a lot of the people that they see aren't surgical. It's just, sometimes people who don't understand the low back well, once a person has something on an MRI, like a disc herniation, they're just told, okay, go see a spine surgeon. But that's not necessarily the next best step. This person's issue was also chronic, long-standing. He didn't really have what he described to be very much neurological functional impairments. And I basically told him, I said, just by the sounds of it, if I had to guess, I'm not giving you a recommendation right now, but it probably sounds like you don't actually need to have surgery, which is great. That's very, very important. If you don't have to have surgery for anything, I think you should always opt out to not have the surgery, because why not, right? Yep. Like, who really wants to go under the knife if you don't have to? And I said, but there's other things that you could be doing. And I gave him recommendations on a biomechanist out of Waterloo University called Stu McGill, who's essentially the foremost expert on low back rehabilitation and how to prevent back pain. And we're lucky because we have him right here in Ontario. So, and I actually think I use him a lot in clinical practice when I give people the things that they should be doing. But I don't think I've brought him up very much on the radio. But anybody that's suffering from low back pain, you should do your own research and just type in the name Stu McGill into Google and look at his exercises that he recommends for low back. Because if you've got that, and you're doing the right graded exercise. Now, again, Stu McGill even recommends that people should be working with an expert to grade the exercises, give it to them. But it's always good to have a good general understanding. Anyways, right. I'm speaking with this person. I go through with him all of this. He's 4 years in the loop of trying to get this figured out. He ends off by saying that in a 5 or 6 minute conversation that I had with him, I had given him more information than he's had in the last 6 years from numerous professionals.
No kidding.
It was such a drastic change to go from that person to hear such, praise in that sense. And he was happy. He understood. I didn't drag him in. I said, no, just stay where you are. Go get this person, do this, versus this other lady who was kind of like, I'm so disappointed with you not being able to help me. But me helping you doesn't necessarily mean that it's going to be me specifically helping you. My help may simply just be a recommendation to continue seeing your family doctor or try a set of exercises or whatever, see a different type of healthcare professional, whatever. There's so many different possibilities that are really case dependent on whatever the person is presenting with. So, that's the free phone consultation. So when you give me a call, I want to talk to everybody. So it doesn't cost you anything. It is a free phone consultation. You give me a call, leave me a message, and I'm going to give you a call back, and we're going to discuss your issue.
That, by the way, is info@paincarecanada.com and 1-855-55 Lou, DRLOU. And the phone lines here are open. You have pain concerns, you're feeling pain, whatever it is, bring it on. Health concerns, here to answer them right till 12 o'clock this afternoon. It's the Dr. Payne Show, Global News Radio, 640 Toronto. 11:14, plenty of time to call in. You have questions, you have pain questions, health questions, bring them on. 416-870-6400, star 640 on cell. We'll get to all that stuff. Jeff, first one up, pal. How are you?
Hey, man. Good morning. Thanks, Dr. Lou, and for taking my call. I'm a long-time listener.
Awesome.
Yeah. So, listen, I was skiing in Austria last week.
Nice.
Poor you.
And,
You poor bastard.
It was beautiful, actually. Yeah, it was gorgeous. It was, 10 degrees, great snow, everything.
Awesome.
But on the last day, what I did was I had a little fall. And my knee's fine, I can run on it, but what I'm having is significant torsion pain on it.
Torsion?
Yeah, so
Okay.
if I move my ankle right to the left or right, but I can pound on it from running, it's no problem.
Okay.
But any flexibility on it, left or right, is extremely painful. And, I don't know what to do. If I should go to the hospital, get it checked out, or, my GP, if he refers me to the specialist, I don't know what to do.
Yeah, I wouldn't go to the emergency room. Obviously, it does sound like it's an emergency. I mean,
No.
the one thing we have to appreciate is the knee is not really meant for much torsion. There's a little bit of range of motion and freedom that it has for those types of movements that you are describing, but it's the knee is a simple hinge joint which is basically made to flex and extend, which is probably why running is okay, but anything that involves some type of a twist when you incorporate the ankle it starts to affect it. Now, that because the knee is not made for that, and because when you think of things like meniscal injuries or ACLs, a lot of the time that's kind of how it happens, is a planted foot with some type of torsion in the knee that leads to that type of thing. Now, it doesn't sound like yours is a full torn meniscus or ACL or anything like that.
No.
But it may be a slight strain of those same ligaments at the same time, or sprain, of those ligaments that is potentially leading to that type of scenario. So, I mean, if you've listened to the show a long time, you've probably over the last few weeks heard Dr. Bergavin, Dr. Gordon, who have been on a few times. And, they've made it quite clear that with something like the knee, the x-rays, the ultrasound, those types of things are never going to be as good as just having someone who knows the knee assess it properly. Yeah. And in all reality, oftentimes family doctors, walk-in doctors, they're there for a different reason. They're gatekeepers of health, so they know a lot about a lot of different things, but they're not specialized in any one thing. So, they may not be the super best people to assess the knee, and maybe other people like chiropractors, physiotherapists, people that specialize in these types of sports injuries might actually be a better bet. And then if need be, potentially seeing a specialist. But now you would also know that we have our knee clinic, which, I think you and I should speak after the show for sure and see if you qualify to see one of the surgeons. Because again, the whole point of this knee clinic, and just because I'm talking to you and I've had a few calls, sometimes people will call in. The whole point of the knee clinic is we're trying to identify people who need surgery. This is the big thing. If you're going to see a surgeon, you're going to see them because you need surgery. Otherwise, you don't need to see them. Yep. A lot of the times when I've gone through it with a person, there's a list of questions that can pretty much do a good job of helping to exclude what something is. And so, or if it's something that's surgical. And so, sometimes people have been like, oh, well, I really want to see the surgeon. It's like, yeah, but if you don't need to, if I'm telling you that you don't need to, why would you want that option, right? You don't want that. So don't be disappointed if we speak after the show and we go through a set of questions and I say, no, it doesn't sound like it's a surgical thing. If I do think it's a surgical thing, the whole reason why we have this program in place is we can skip all the BS of you coming to see me and then going to see that person or family doctor and then that. No, just skip it and go
fast
straight.
Track it.
Yeah, fast track it and just go straight to that. And the reason why those surgeons are willing to run this program with me is because they know I'll assess it properly. That's the difference, right? That's why, that whole stat about why spine surgeons are oversaturated. Most surgeons are oversaturated because a lot of people that see surgeons don't actually end up needing surgery. And so, if there's better outcomes and algorithms to try to determine who the best people are to see a surgeon, then that's going to help everything. That's going to help the surgeon with, what they need to do, which is surgery. It's going to help the patient with seeing the right person. And it's also going to improve the overall system. But yeah, it doesn't sound like you've done anything major, but maybe the start of some slight sprain strain presentation and definitely something we can look at for sure.
Yeah, thanks, Dr. You guys rock. Yeah, it's
awesome.
Just, it's a little swollen, a little warm still. I get a little tingling.
Are you icing it?
I've been elevating and icing it, absolutely.
So give me a call on the 1-855-55-DRLOU number and just leave me a message, and I'll give you a call and we'll discuss everything.
Okay, you guys rock. Have a great weekend.
Awesome,
Thanks.
you too.
Thanks, Jeffy. Keep care of that knee, and your phone calls coming up as well. I see you there, Peter, and for you as well, 416-870-6400, star 640 on cell. Dr. Payne Show continues. Global News Radio, 640 Toronto. Lots of time to call in. You have questions, pain questions, health questions. Bring them on, 416-870-6400, star 640 on cell. info@paincarecanada.com is the email. And if you want to get a hold of Dr. Lou anytime, 1-855-55-DRLOU. Pete, how are you?
Good morning. Great. Thanks. How are you doing?
Good, bud. What's going on?
So I'm an active guy. Try to stay fit. I've been training in martial arts most of my life. The last 7 or 8 months, I've had issues with my hip and my lower back, and it doesn't really. I stretch. My hip gets sore if I sort of overuse it now, and it seems. Even if I'm now busy doing stuff around the house, by the end of the day, my lower back is really sore and really stiff, and I'm just not sure. I'm sure they're related in some way, but I'm not really sure what's the best course to go and get it fixed. I've looked at chiropractors and others, but I'm just not sure what's going on.
Sure. So when you say hip, let's try to make sure that it's the actual hip. Do you mean the front, the groin area, or in the back towards the butt?
So I've had pain in the hip flexor, and then after a long day or training, it'll be pain sort of feels like right in the hip joint.
Right in the hip, so right anteriorly, like in the front of the body type of thing.
Correct.
Okay,
Correct.
And then and that's the right or the left side?
Left side.
Left side, and the low back pain is also on the same side?
The low back seems to be center lower back.
Center lower back. Okay. Yeah. And how old are you, Peter?
49.
49. Any other history like of low back pain issues prior, or hip issues, anything like that?
Never. And again, I've always been active. We've been training in martial arts most of my life. Never had back problems. Never had hip problems. Just the last 6 to 8 months, it seems to have come on, and it's really getting frustrating.
And you would say it's pretty constant, or tends to come and go?
Well, the hip seems to be sore daily.
Okay.
And it seems to be worse, obviously, the more I use it. Back pain, generally okay, unless I've been doing a lot of renovations around my house lately, so by the end of the day, my back I can barely stand up, and it's really sore.
Okay, so it's fair to say that both the hip and the low back seem to be related more to overuse versus if you're at rest.
Correct.
Okay. Well, okay. That starts to tip me off, obviously, towards the overuse. You start to think more mechanical causes of somebody's pain, which obviously this very much sounds like it. But the reality is that low back and hip issues can be referred by visceral organs and things like that. So yeah, it definitely sounds more on the mechanical side, which is good. One thing that's important to always note, and not just for yourself, but for everybody, is people often say, I've never had anything like this before, and all of a sudden I have it. Well, sometimes that's just the way your body breaks down, is that eventually there's just the straw that breaks the camel's back, and you all of a sudden start to feel those things. Right. So, and the other thing here is you may have one issue that's causing both the symptoms of the low back and the hip pain, or you may very well have two separate issues, or it might be two separate issues that are somehow related from a functional perspective. And so, that obviously is going to be difficult for me to tell you over the radio here. But that is where, with a proper assessment, someone is going to be able to figure out, okay, what exactly is going on here? Is this a result of something like a disc issue, potentially causing radiation? Where exactly in your low back is the pain? Is it higher up in the low back or lower down?
Lower down. Like right above my hips.
Right above the hips. Okay, so so those nerves tend to go, the nerves in the like L1, L2 tend to, and T12, T11 tend to refer into the anterior groin. So sometimes people can have issues at, low mid back to high low back, and it can cause anterior hip pain. Sometimes SI joint pain, so the sacroiliac joint, which is where the sacrum and the ilium meet at the back. Sometimes that can also cause a referral pain anteriorly to the hip. It could also be the hip. If you're a very active guy, there might be some OA going on in that hip, and it's just starting to break down, and maybe because the hip is starting to break down a little bit, your low back is now starting to get inflamed as a form of compensation, or it could be a couple of other things. It's really obviously very difficult to say. I would say, again, your best bet. Have you seen anybody or nobody at all?
I mean, I've been to a chiropractor, but that's just more functional to get it moving and sort of loosen it up. But I've never got any diagnosis on it.
Okay, so no one's ever formally tried to diagnose you or anything like that. I guess no. The chiro's been more manipulation based work, like more from. Okay, yeah. So not all chiros practice that way either. There are other chiros, such as myself, that are going to practice more from a diagnostic perspective. So you may want to try seeing a different chiropractor that has more of that approach. I see you're up in, where are you, Port Perry? We can speak after the show, and I can help you find somewhere closer to home for you to go. But I think you have to get it checked out, and I think it sounds like you already know that, and that's going to be the only way. And I don't advise waiting much longer than you already have, just because, again, once you start to look at the chronicity of things, once you start to pass the 6-month mark, that's when things, start to set in the chronic stage. And that means that they become harder and harder to treat. So I think the sooner the better, for sure.
Okay.
Okay.
Great. Thanks. I appreciate it.
No problem.
Thanks, Peter. It's 1-855-55 Dr. Lou, DRLOU. Now, when you talk chronicity, you mean it's not only physically gets harder to treat, or becomes a mental pathway now to break down?
100%. The longer it goes, the more of a mental pathway. Now, the good thing is that 6 months, it's not that kind of a pathway yet. But when you're dealing with people who say I've had something for I've met people that say I have had low back pain for 30 years.
That's me.
Well, yeah. Yeah, there's a big psychological component there, right? And when I say, again, I got to think of a better term for it. Neuropathic is the term, but I guess I want to use a term that people will understand. But psychological, not meaning like personality and things like that. It's not like you're crazy, because this is what a lot of people think. It's what I simply mean by it is your brain is your motherboard for your body, and the more times you run a certain message one way from the body to the brain, and you repeat that message somehow gets learned. And
it's like the missing limb itch, right?
Yeah, it is all going to become ingrained. And so as it becomes ingrained, that is why these things become harder and harder to treat. And that psychological, mental component of the pain is so very, very important.
It's like a brain habit, right?
100%, yeah. And then there's a big spiral around that, and we can we'll go into all that stuff when we come back from break.
Sure we will. And your phone calls as well. Bring them on. Open lines, 416-870-6400, star 640 on your cell. Dr. Payne Show. Global News Radio 640 Toronto, 416-870-6400, star 640 on cell. You got questions, pain, health questions, bring them on. Dr. Lou's here till 12 o'clock. Hey, Dave, welcome.
Hey, I have a pain in the front of my leg, and it's kind of like in the groin area. It's numb, it burns, and I'm just wondering if it could be nerve damage.
Well, it definitely sounds like it's a nerve symptom. That I could tell you for sure when someone says numbness and burning, those are all neurological types of symptoms, which, leads me to believe that something neurological is the culprit. Is it damage to the extent that's not, reversible? I'm not sure that's going to be much harder for me to answer over this, but give me a little bit of history. When did this all start?
I'd say about 3 weeks ago. I was just out one night. I hurt my lower back.
Mm-hmm.
So it was hurt for like probably a week. I was in bed. And then as that was going on, just my groin area and the top of my thigh, I noticed it was really numb and burning and just very uncomfortable.
Yeah, so I mean, if there's some type of correspondence between back and the groin and the numbness, obviously, as I was saying to the previous caller, all of the nerves that go to the pelvis area and in the legs come from somewhere in the low back, whether it's higher up or lower down. But they all come from there. So if it all kind of started at the same time, then I mean that starts to put together a correlation, potentially causation type of relationship there. So maybe that means that you were doing something, you set off your back, and now the nerve in your back is aggravated, and you're feeling that pain at its termination point, which would be in the groin area or at a part in that nerve. So, or again, it might be a separate issue where you may have this back pain, but you may also have a nerve issue in the inner thigh. Have you ever had anything like this before?
No, never.
No. How old are you?
I'm 50.
50. Okay. Yeah. I mean, I think it's something you should definitely get checked out because, there's no way. I think at 3 weeks, this is when you get things checked out for sure. The earlier, the better, especially when it comes to nerves, because nerves can take sometimes they never heal. And when they do heal, they can take a very long time because nerve tissue it almost doesn't regenerate at all. And even once you remove an irritation off of it, it does take time for that nerve to start to get all its proper function back. So I think it's good that it's early, but I think you need to be seeing someone just to try to get it figured out.
Okay, so my practitioner setting me up for an MRI is on the right track.
That sounds like it's on the right track, yeah. I mean, the only issue there that I would say is, again, sometimes testing is not necessarily as important as good physical testing. Potentially with an MRI, you might be waiting 3 months, and now all of a sudden we get into that same discussion. You're waiting around, you're not getting better. So, I mean, go see a chiro, go see a physio, somebody to help with that, a massage therapist, someone who really understands those things well. In the meantime, that it's good that MRI has already been ordered, but you could be seeing someone else to also start doing some therapy, and then hopefully once you have the MRI, it all comes back clear. But then again, it brings up the question of a broken system in a sense, because you get better and then you go for an MRI, you spend all that money and it doesn't show anything. So I wouldn't say wait around for the MRI because you may be waiting around for a while.
So be proactive on these sorts of things.
Yes, sir.
Always.
Yes, sir.
Yeah.
All right.
Okay, well, thank you very much. Great show, and have a great afternoon. Bye-bye.
You too.
Thank you, Dave. Appreciate that. Again, 1-855-55 Dr. Lou, DRLOU. If you want to follow up later on, feel free to do so. Marianne, good morning.
Hi.
How are you?
Hi, how are you?
Good. What's going on?
Thanks. I've just been recently diagnosed with 2 partial tears in my rotator cuff by ultrasound.
Okay.
So my family physician has recommended extreme physiotherapy as the first line of defense. Mm-hmm. My concern lies with, do I do that, or should I, bite the bullet and go see an orthopedic surgeon, since I do have a mechanical issue?
So my question would be, did your family doctor perform a physical exam on your shoulder as well?
She movement-wise, yeah.
Yeah, like did she do specific orthopedic tests and those things, or was it just generally like, hey, lift your arm, bring it down, let's send you for an ultrasound?
Just lift your arm, bring it down, let's send you for an ultrasound, because I had gone to physio and it was getting better. Right. Yeah. Originally.
So that for me is one of the things when you look at, like, when someone tells me I've been diagnosed with something on ultrasound, that's an impression, not a diagnosis, because a radiologist doesn't hasn't clinically seen the person. in my experience, and again, we've had Dr. Bergava, who's an orthopedic surgeon specializing in shoulders, on the show previously. And also, again, my experience, what I've seen in practice, a lot of the times partial tears don't necessarily correlate with what's causing the person's pain. Partial tears are something like wear and tear. It's kind of like osteoarthritis of the low back and just simple degenerative disc disease. It may very well be the culprit. I'm not saying it's not.
Because I did have trauma by falling.
Okay.
And so after that, it wasn't immediate, but it seemed to be 2 months after my fall, it was there.
Right, but did you have an ultrasound prior to that fall to know that you didn't have partial thickness tears at that? No. Right, and that's what when we look at this from a research perspective, that's a lot of the times what we find is that a lot of the times it's kind of like if someone says, "Hey, I hurt my low back and it has degenerative disc disease," it's easier for us to understand. Well, that didn't just happen, but with a partial thickness tear of a rotator cuff muscle, it may very well have happened from the trauma. It may also not have happened from the trauma. You were seeing a physiotherapist already. What did they suggest was the problem?
Well, the physiotherapist was adamant that there was nothing wrong, like there wasn't a tear.
Okay.
He was like, no, that's not a tear. Not a tear, but it wasn't getting any better. So that's where I thought, okay, let me go see my family doctor. And, of course, first they did X-ray and then they did the ultrasound. Mm-hmm. And she said prior to booking an MRI and potentially seeing an orthopedic specialist, let's try this route first.
Okay, so what were you doing with the physiotherapist? What type of therapies was he or she doing?
They were doing ultrasound and ice and cold packs and exercises.
Okay, yeah. So I mean, it might have just been again. And how much treatment did you do with them?
I did about 6 weeks, 3 times a week.
Okay, so that's a significant course of therapy. It may have just been the wrong type of therapy to do. I would say that I maybe tend to agree with your family doctor on this, that I don't know that going to see an orthopedic, like you have to also understand an orthopedic surgeon is not going to really do much for partial thickness tears, right? They don't, like if you have a full tear of it, they'll go in and they essentially snap it back into place. But, for something that's a partial thickness tear, there's not really much that can be done from a surgical perspective.
So with extensive physio, should the pain be alleviated at some point? Would there be an increase in range of motion? Because getting dressed, doing just regular daily activities is painful.
Yeah. So what I would say is the whole goal with rehabilitation, and when you're doing rehabilitation, should be first to get the function and range back of the area that you're working with, and then pain is secondary. So, where are you at? You're in Brampton, I see. Give me a call, and maybe I can assess this for you, and I can maybe recommend a good therapy place for this, because where Dr. Bergava works, they have a physiotherapy clinic in there, and they specifically deal with knees and shoulders. Excuse me. So that may be a good place to deal with, just because that's what those physiotherapists are dealing with all the time. So maybe having someone more specialized in the physiotherapy or chiropractic world look at it might be a better idea.
Okay, sounds good.
All right.
Thank you, Marianne. Appreciate that. Again, 1-855-55 Dr. Lou, DRLOU, info@paincarecanada.com. And your phone call, still got lots of time here till 12 o'clock this afternoon. 416-870-6400, star 640 on cell. Dr. Payne Show, Global News Radio, 640 Toronto. 416-870-6400, star 640 on cell. Got an email, by the way, info@paincarecanada.com. You'll want to reach out to. You just got this right now. What does it say?
Yeah, and this isn't a question. It's more of a concern that someone raised, and we'll go through in a sec. But I also want to say that anybody, at any point, if you're listening and you want to have, a good conversations, because some people may disagree or think that I'm wrong on the things that I'm saying. I'm happy to discuss that as long as it's done respectfully on everyone's part, right? Like, I don't want someone calling in telling me I'm an idiot.
You're
like,
a DB. Thanks.
Yeah, we can have this as, and Robert, who sent this email, did it in a very respectful way, which I appreciate. And so I want to, address this point. So it's quite long, so I'm not going to read the whole thing, but essentially the gist of it is that he listens to the show quite often, but he thinks that he disagrees with the point that chiropractors can help alleviate and diagnose pain, because there's a lot of chiropractors out there that practice what's called a subluxation method. And that subluxation method is more based on just spinal adjustment and, doing those things. Now, what I can say is I need to try to a fine line here because I'm part of the profession, and so we have rules and regulations where we can't say negative things about our peers. What I will say is this: is that yes, there are two parts to the profession for sure. And one part of the profession practices very much the way I do. That is simply based on diagnosis, proper evidence-based medicine diagnosis, and treatment with the things that we do. Now, obviously, I do it a little bit different because I also have a large team of other healthcare professionals, so I can make internal referrals, etc. But there is a group of chiropractors that practice more of a wellness-based method where it's not really, you're not going there to get a diagnosis about your pain. You're just simply going there because it's more of this wellness approach that the belief is that spinal adjusting, manipulation, they don't call it manipulation, they'll call it adjusting, leads to some other type of secondary health benefit. I don't practice that way, so I'm not going to comment on it. Yeah. I can tell you that I know people that sometimes go to that type of chiropractor and have very good outcomes. And I know some people that go to chiropractors like me and have good outcomes. And I equally know people that go to chiropractors that practice the subluxation method and don't have good outcomes. And equivocally so.
Of course, it's all over the map.
It's all over the map. What I will say is I believe whenever you see any healthcare professional, because the reality is you can use the chiropractic profession for this as an example, but really every healthcare profession has people. There's some doctors that are heavy pill pushers, like family doctors, and then there's others that are not. They won't give you a pill if their life depended on it. There's physiotherapists that practice only exercises, but then there's others that'll say, no, I also use some machinery and I like to do some manual therapy. There's always different schools within each profession. Yep. What I always encourage people to do is don't necessarily crucify somebody because of their profession. If you're going to crucify somebody, crucify them because they've earned it. Right. So if someone has done something wrong to you or you don't believe what they're saying or whatever, or there's a lot of red flags, then that is the person that you can say, I don't trust that person. But let's not just, like in Andrew's point here, he's putting a banner on all of these chiropractors. And I'm only saying, let's not do that. If you know of specific ones that you believe are not doing the right things, then fine. That is that. But there's also a group of chiropractors such as myself that don't practice that way, and maybe those are the chiropractors that are best suited for this type of person. Right. Equally so, there may be people out there just looking for that wellness-based approach. And yes, the wellness-based approach of adjusting does lack scientific evidence, but some people are okay with that. Some people are doing some really weird therapies out there that have no scientific basis whatsoever. My big thing is as long as you are okay, if you are an informed consumer as a patient, as long as you are informed, you're okay with what's happening, then I don't see anything wrong with it. And I think you need to be informed. And I think you have to have an open mind that you, on either side of that doesn't mean you should accept everything that someone says. It means you should be critical of what people say. And critical doesn't mean negative. It means just critique it. There's good and there's positive. If the good outweighs the bad, then you go with it, and that's your choice. So yeah, just to address that point that Robert sent over, that is within every profession, not just healthcare. I think most professions have different schools of thought within each profession, and so if you don't want to see a certain school of thought within a profession, that's your choice. But that doesn't mean you should never use that profession.
I remember that you showed me that video about a year ago. That doctor, he gets people just he gets them a good yank.
Yeah, there's a guy in Texas. Yeah, he does it. Yeah, exactly. And that's something like I would never do, but this guy's got millions of hits on YouTube. So obviously people are going to see him. And again, that's not what I'm here to discuss. And that's another thing with me. Sometimes when people are like, oh, but you're a chiropractor, so am I going to get chiropractic treatment? No. You're going to get a pain assessment with me. Once you get that assessment, we're going to determine what is wrong, and I'm going to give you the evidence-based recommendation. I very often will refer to chiropractors within my clinic, but I also very often will refer to the physios, the massage therapists, the surgeons, the family doctors. It's whatever is the person needs. And we have to remember that we have so much at our disposal that treating people with pain and injuries using this multifaceted approach is going to be what provides the best outcomes for people.
416-870-6400 star 640 on still got some you still got some time rather to call through, get into the Dr. Payne show here, get your questions, comments to us, info@paincarecanada.com, and outside of show hours, of course, 1-855-55-Dr. Lou, DRLOU. It's Dr. Payne Show, Global News Radio, 640 Toronto. 11:54, still got some time, 416-870-6400, star 640 on cell. You want to reach out to Dr. Lou anytime, it's info@paincarecanada.com and 1-855-55-Dr. Lou, DRLOU. It is almost spring. You can't tell by the temperatures, but it's bright in the morning. Soon it's going to be the golf, going to be the inline skating, going to be the cycling, going to be all that stuff, and your clinic's going to fill up with sports injuries.
Yeah, it happens at the transition of every season because there's always something. It's a different sport or whatever. But definitely, this time of the year is people want to get more active, so they're more willing to go out and start running and do
risk their joints.
And do those things. And I mean, we've talked about this before, that one of the biggest things that prevents people from achieving their health goals in terms of like losing weight, getting muscle, whatever it is their goal may be, in that is they sustain an injury and it stops them. And I mean, we've been doing this show for a while now, and I mean, I think you get the sense that, even as humans ourselves, we tend to put things off, right? Like we don't hurt ourselves today, tomorrow, and think, okay, I better get this checked out right away. But the one thing that I can tell you is if you can make a conscious effort to be that way when it comes to injuries, I think it's going to be very good for you, because it's really going to help improve how likely you are to continue with your goals, because you don't want an injury especially as you get older. Injuries don't just really get better by themselves. Sometimes the symptom of pain will disappear, but maybe the injury is still kind of there. The other thing too that we struggle with a lot of times when we see people with you say, just as an example, someone says, I used to have a shoulder injury and then it kind of healed itself, and now I re-aggravated my shoulder injury. Well, when the body, especially with tears, breaks, things like that, the body heals in such a way that's called a haphazard manner. So, when you if you were to look at muscle or tendons or things under microscope, all the fibers are aligned a certain way. That makes sense, right? Like if you're going to put flooring in your house, you're going to align it the same way. It's just kind of the natural way to do things. However, when the body heals itself, it's really good at creating itself, right, from the get-go. But when it starts to heal itself, imagine you've got an area of flooring that just broke. Instead of, realigning it perfectly straight, what the body does is just starts jamming stuff every single way. It's kind of like if a window, like when you've seen people's windows,
it's like scar tissue on the outside looks different.
Exactly. That's a great point. Yeah, scar tissue on the outside of your body looks different than the actual skin because it's haphazard. It's just really meant to be a short-term safety net, because again, when you think about it, our bodies weren't designed, like if you hurt your shoulder 10,000 years ago, it just needed to heal so that you could live for, the next 5-10 years and then good enough. But, now when you're living an extra 50, 60, 70 years, whatever it may be, well, that haphazard way of healing may not necessarily be the most ideal for the way we live today and the length of time that we live. And so sometimes when we're intervening on that, we actually have to try to break down that injury and get it to re-heal, which again is no easy task, especially if it's an old injury. If it's a little bit newer, it's a little bit easier, but not when it's an old injury. It's almost impossible, actually.
We got time to grab a call. Gary, how are you?
Yeah, hi, good, thank you. I have a quick question. I was just wondering what kind of treatment I should get for my neck. I woke up about a year ago and I had the stiff neck and it just never went away.
Yep.
And I had an X-ray done on it and they said it was degenerative disc.
Yeah. So this goes back to like what I was saying about the shoulder issue with the partial tears. Like everybody's going to have some form of degenerative disc disease. Whenever someone calls me and says I have blank pain, whether it's neck pain, low back pain, and the next question is what treatment should I get? My first and answer always to that is you need to get a diagnosis first. You need to figure out exactly what the pain generating structure is. Once we know that, then the treatment gets recommended based on that. So I would tell you that your first step, Gary, is you need to get that assessed properly by someone who's competent, that understands more than just saying it's degenerative disc disease, and then from there getting it treated the right way based on whatever the diagnosis is, because if your diagnosis is wrong, likely your treatment will be wrong, and that's no good. And guys, this all starts with a simple free phone consultation for everybody listening. I'm happy to provide this advice at any point and just have a discussion. And sometimes it'll result in you coming to see me, and other times it'll just be stuff that you can continue to do on your own or with your current healthcare team. But it doesn't cost you anything, so give me a call or send me an email.
Okay. What is the number for your office?
1-855-55 Dr. Lou, DRLOU.
Okay, great.
Okay.
Thank you so much. I appreciate that.
No problem.
Good way to end it, Gary. Good for another week. Yeah, that number, 1-855-55 Dr. Lou, DRLOU. Reach out, call the doctor, and email as well, info@paincarecanada.com. Till next time, Dr. Payne Show, Global News Radio, 640 Toronto.